Hello, and welcome to an overview of UCSB's Counseling and Psych Services, as well as our mental health care program. Before we get into all of the CAP services, just a reminder that this Division of Student Affairs at UCSB has really been having a ton of conversations about mental health and the importance of support to student success, and really wanting to address mental health concerns within students in ways that feel accessible and inclusive to all. So with that said, CAPS is just one of the many options for support. So we encourage everyone to check out wellbeing.ucsb.edu, as is stated right there on the screen. This is an overview website that is really meant to be a single point of entry for students that are wanting to get connected with some sort of well-being service and aren't really quite sure where to start. Mental health, we also know, is truly quite a wide umbrella of services. And we're talking about food insecurity, when we're talking about financial concerns, housing, tech accessibility, and then more well-being focused things like mental health, health and wellness, meditation, substance use and abuse. So again, just a reminder and an encouragement to really check out wellbeing.ucsb.edu. In terms of our CAP staff, we currently have over 25 licensed clinicians. A huge number of those clinicians are psychologists, so most of our staff are doctoral level clinicians. We also have master's level clinical coordinators who are helping do many of our intake and triage appointments, so our brief assessments. Those are done by our clinical coordinators who are master's level. We are also super proud of the fact that our center is an APA accredited training center. So we have every different level of trainee, psychology trainee within our center. So as is listed on the screen, we have 3 postdoctoral fellows, and these are students who, I guess not really students anymore, psychologists who are in their sort of last leg of training right before becoming full-fledged psychologists. We have 3 doctoral interns, so very similar to the medical match system for programs in residency. Psychology has the same sort of setup, and so we get 3 doctoral interns from all over the country. Every year we get to keep them for 1 academic year, and it's an incredibly intensive application process for them. So we're always excited to join or to welcome 3 new interns every summer. And then we have 3 practicum students, and these are students who are actually within their psychology department on our campus at UCSB. So they are in the first few years of their psychological training. So again, a point of pride for our center. I know that there does tend to be some hesitation around, well, I don't want to see a trainee. So just want to qualify that statement with it. We are completely transparent when that does happen. So if you are offered an appointment with a trainee, you will be told that that is the case. And there is supervision at every level. So just wanting to put that out there. The image on the screen is one of our many staff meetings over Zoom during this past year, and just wanting to remind everyone that CAPS is still here. I'll talk a little bit about this in a minute, but there has been no lapse in service. When we went into COVID teletherapy, we did that very swiftly, and there was no break in service to our students. So we were very proud of the fact that we could continue to support our students in a very different modality than we had done before. In terms of locations, we are currently, as of the middle of July 2021, still working completely remotely. And so students are accessing our services completely via Zoom or phone. We are making transition plans for fall 2021 to be looking at coming back into the office in some sort of fashion, but also really trying to figure out if a hybrid model will work for CAPS and for students. Many students really preferred being able to access their therapy via Zoom or via phone. And we actually had students access our service in record numbers during the first summer of COVID. Many students who typically would have gone home and wouldn't have been accessing therapy with their clinicians were able to maintain that relationship because they could truly access therapy from anywhere in the world. So we are really looking to keep some of those offerings and figure out some sort of hybrid option that is going to work well both for CAPS and for students. When we are on campus, we are located in one main office, and then we have 7 satellite locations. Our director and our leadership team strongly believe in the community psychology model, and we like having our staff be able to sort of be fully immersed in some of these communities. We have several psychologists that are found within housing. We have a graduate housing psychologist. We have a couple of psychologists who are housed in freshman housing. We also have more culturally based centers where our psychologists are located. There's an Isla Vista office where a handful of our psychologists are as well. We also understand that for some students, the stigma around walking into that main building can be one of the biggest hurdles. And so being able to offer appointments in locations that are outside of that main office can sometimes really help, particularly with maybe graduate students who don't want to run into their students that they're TAing for, or, for whatever reason, we liked being able to offer that option. The image on the screen is just a screenshot. There is a full list and an interactive map on our website, so caps.sa.ucsb.edu. We often get questions about who can access our services, and the answer is that all registered undergrad and graduate students, regardless of insurance status. So there is a lot of confusion around what insurance do I need to have to be able to access services at CAPS. There is no cost at the time of service when students walk in. Again, those are all covered by student fees, which are part of tuition. Where insurance does play a part is in being referred out into the community. But again, that is a conversation that will be had between a student and their clinician, and all of those unique sort of hurdles can be talked about when talking about co-payments and traveling to those appointments. What kinds of concerns bring students to CAPS? So really everything and anything. The two biggest sort of diagnoses have been anxiety and depression for a very long time. Anxiety has sort of been the reigning #1 for the past few years. But really we have students coming in for a lot of very different things. Life stress, as I mentioned earlier, mental health does include things like food insecurity, financial insecurity, housing, so houselessness, academic anxiety. Obviously transitioning into the university can bring up a lot of academic anxiety, mental health issues. So again, anxiety, depression, trauma, sleep concerns. Difficulties in relationships tends to be the #3 after anxiety and depression. And this is defined pretty broadly, but we encompass that with family, romantic partners, friends, roommates, basically any sort of interpersonal relationship. And that can also include interpersonal relationships with TAs, RAs, professors, and also just a lack of relational support. So for students really wanting to get more connected and not being sure how to do that. Substance use and abuse is something that also gets brought up during sessions. Trauma, suicidal and homicidal ideation. Suicide is actually the second leading cause of death for college students. And so it's something that we take seriously, and we do suicide prevention programming, and we will definitely assess for suicidal and homicidal ideation. And psychosis is also listed. What services does CAPS offer? So to initiate services at CAPS, you always go through a brief assessment. This is a 15 to 30-minute appointment done with one of our clinical coordinators. And this initial assessment is not meant to be sort of a full-fledged first counseling appointment. It is truly meant to be an opportunity to have a conversation with one of our coordinators and figure out what would be the best treatment plan for your concerns. That can look like setting you up with individual therapy. It can look like setting you up with signing up for some of our group therapy offerings. If you or if someone has been in counseling for a long time and just wants to connect to CAPS to continue seeing someone pretty consistently, or there is some concern that could really be supported best by more consistent therapy, we will often refer out into the community. And so those referrals are done through a brief assessment often. We want students to be able to start their actual therapy with a clinician as opposed to starting at CAPS, for a few sessions and then being referred out into the community and having to basically start over. And so we really do see it as a great opportunity to have students understand from the get-go what they might be wanting from counseling. And often a referral into the community is the best option. We also have single session therapy, which is a newer offering at CAPS. These appointments differ from a regular brief appointment brief individual appointment, in that instead of 50 to 60 minutes, it's a 90-minute appointment. And these are much more solution-focused appointments. Students coming into single session therapy are asked to come up with something they are either trying to solve, some situation that they want to focus on, and it is much more targeted and not meant to be a longer term therapeutic experience. We also offer crisis appointments, consultation, whether you're a parent, you're another student worried about a friend or a roommate, a staff member, anything or anyone, you are welcome to consult with CAPS. What we will always say, though, is that we cannot confirm nor deny whether we're seeing the student that you are concerned about, but we are always happy to take information and guide you in the right direction in terms of informing the appropriate parties on campus. CAPS also offers outreach, and so we do presentations to student organizations, to staff, to faculty, and also a lot of our outreach is done by our mental health peer program. An additional note in terms of CAPS services, CAPS does have a 24/7 phone counseling line. And so that number is on the screen, 805-893-4411. It's a great phone number to keep in your phone. You may not feel like you will ever need it, but inevitably we have all been in situations where we're supporting a friend or a roommate or a classmate. And it is a great option to be able to call that phone number together. Those calls are then followed up by our CAPS clinicians the next morning. And I often get asked if students actually use that phone number, and they do. We get a couple of calls almost every night. And since the phone number is available during evenings, weekends, holidays, it really is a great thing to turn to. In terms of services for fall 2021, more updates will be posted on the website as decision-making is happening with safety in mind. One clarification that I'd like to make is what does brief individual therapy mean? So on average, our students see a CAPS therapist between 3 and 4 sessions. There is no set session limit, however, at CAPS. And although many universities do choose to have a session limit, our CAPS leadership strongly believes in the uniqueness of everyone's experience. And that decision and that conversation truly happens between the clinician and the student. So there are many factors that are weighed in that decision. And the treatment plan is always talked about with those in mind. So again, the fact that students only see a CAPS therapist between 3 and 4 sessions is truly just an average. And it really is dependent on the circumstances and the student. For our group counseling program, we have quite a robust group counseling program, and more offerings are being added. During COVID, we have continued our group offerings via Zoom, which students have really enjoyed. We have split up our groups at this point in time into 3 categories, so psychoeducational and skills groups, and those include our mindfulness groups. We have community-specific groups, and then we also have interpersonal process groups. So these include both interpersonal and trauma-focused groups. The offerings for group therapy can be found on caps.sa.ucsb.edu under the group counseling tab on our main menu bar. Those offerings are updated every quarter. And so currently, as it is July 2021, as of this recording, we have our summer groups up, and then fall groups will be posted hopefully by mid-September for fall 2021. And then a quick overview of our mental health peer program. For fall 2021, we are expecting to have a group of 10 mental health peers made up of undergrad and graduate students. We have the school anxiety program, which is a individualized one-on-one program where students can sign up to meet with one of our mental health peers for 3 hours, so 1 hour for 3 weeks in a row, to discuss school anxiety and coping techniques. So that has become a pretty popular program. The mental health peers also offer quite a few workshops, currently remotely, but hoping to get back in person. They have a pretty strong social media presence, so I will put their handle on the next slide. Quite a bit of outreach as well. So we take outreach requests from student organizations, faculty, staff, and are happy to collaborate on programming. And then when we are in person, there is an in-person relaxation aspect to the program where we have an actual physical location for the mental health peer program office. And as you see on the screen, we have massage chairs and an alpha wave chair. It's to be determined how this will function during COVID times, but we are hoping to be able to offer these relaxation services to students once again when we are on campus. And those services are typically used on a drop-in basis and are open during regular business hours. As I had mentioned, social media presence can be found at UCSB Mental Health Peers, both on Facebook, Instagram, and soon to be on TikTok. We also have a very robust presence on our website. There is a ton of information at ucsbmhp.com. So visiting that, there are tabs for unique challenges for student groups. There's an overview on coping, really just a wealth of information that can be found on this website. And then we often get questions about other wellness related or mental health related services on our campus. So this is by no means an exhaustive list, but we also do have psychiatry and social work on campus, and that is housed within our student health center. The alcohol and drug program is also actually housed within our student health center. Campus advocacy, resources, and education, otherwise known as CARE, is for our student survivors and those who have had experiences with interpersonal violence. There's academic support, both at the college level and at the department level. There's basic needs support, disabled students program, and most of these links can be found directly from the wellbeing.ucsb.edu website. So rather than linking directly, going to that website first may be a great entry point, depending on your concerns. And that concludes our very quick overview of counseling and psych services on the UCSB campus. As you can see right there, our main website is caps.sa.ucsb.edu, and the MHP website is ucsbmhp.com. And again, that 24/7 number is 805-893-4411. If you have any additional questions, please feel free to reach out to CAPS, and we are more than happy to connect with you and answer your questions. We hope this has been informative. Thank you so much.